everyone. So today we'll discuss about the pathophysiology of the blood donation. So we will be seeing in the future slides like introduction, how the body respond to the blood loss, regeneration of the hemoglobin, how what is the venipuncture technique, donor care after the donation, and what are the benefits of the donation. The blood donation process places a unique set of physiological as well as the psychological demands on the donor. So these include the postural challenges upon standing from the prolonged period of reclined seating, loss of blood volume, and the potential fear and the anxiety. So all these factors can combine and they will produce a reduction in the cerebral perfusion and in turn can result in a range of reaction from the mild pre-syncopal symptom such as dizziness, lightheadedness to the period of syncope that can last for a few seconds in mild cases to minutes in the more severe cases. So during the blood donation process, there is a reclined posture, and then there is a sudden stand. So the blood will get pooled in the legs. After the pooling of blood in the legs, there will be decreased blood pressure. So this decreased blood pressure lead to cerebral hypoperfusion, which can cause a syncopal reaction. Or when we draw the blood, there is a reduced blood volume. All this can lead to the decreased blood pressure, cerebral perfusion, and a syncopal reaction. Or if the donor is having fear or anxiety, then it will affect the ANS fluctuations can occur in that donor and that can lead to the decreased blood pressure, cerebral perfusion, hypoperfusions and the syncopal reactions. How a body respond to this blood loss? So in a healthy individual, after the loss of 450 ml of blood during a time period of 5 to 15 minutes, there will be a trivial effects on the circulation. There will be no change in the blood pressure or the pulse rate. Although venous pressure may fall slightly, but it takes more than 30 minutes to regain its initial level. There will be fall in the venous pressure, which can cause the fall in the CVP and the cardiac output. There will be fall in the arterial pressure, which can lead to adrenergic stimulation, which will increase the heart rate and the force of contraction, constriction of the veins and the venules, and increased peripheral resistance. Reduced capillary pressure and the plasma volume is restored at the expense of the intracellular and extracellular fluid. How the hemoglobin regenerates itself. So in a normal healthy person, when there is a bleed of 450 ml or 400 ml of blood, there will be circulating reticulocyte increase minimally and significantly and peaked on the ninth day after the bleeding. So the hemoglobin level was lowest in the initial week after the bleeding and increased rapidly thereafter, reaching the pre-donation level at 6 to 12 weeks. Millions of RBCs are being made and dying every second. When you give a blood, you will lose the red cells and the body need to make more to replace them. Special cells in the kidney, these are called the peritubular cells. They will sense the level of the oxygen in the blood that it has decreased and it will start secreting a protein called erythropoietin. This passes through the bloodstream until it reaches the bone marrow and the bone marrow produces the stem cells, which are the building blocks that the body uses to make the different blood cells like red cells, white cells, and the platelets. Now, the hemoglobin level. Before every donation, we always test the hemoglobin. We'll make sure that the hemoglobin level is above 12.5 or 12.5 gram by deciliter. This is because any iron deficiency can result in the reduced hemoglobin level and eventually if it's not treated in iron deficiency anemia, this deficiency can make the donor feel tired. Now the iron levels. The body store iron in the two forms, ferritin and the hemocytin, the protein that found in the liver, bone marrow, spleen, muscle. If too much of iron is taken out of the storage and it is not replaced through the dietary sources, iron stores may become depleted and the hemoglobin level falls. After a donation, most people hemoglobin level are normal back in the 6 to 12 weeks. This is why we ask donors to wait for at least 12 weeks after the donation to ensure that we are not risking the life of the donor by lowering their hemoglobin level over a long term. Now, how we do the phlebotomy? So the term phlebotomy has the two words. That means the phleba means the vein and the tomy means to make the incision. It should be performed by the trained person. And usually the cubital fossa is chosen as the vein is palpable and it requires the volume of blood that can be easily drawn from this vein. So we have to examine the area which is chosen for the vein puncture and it should not have any local infections. Now we have to select the suitable vein in the antecubital area. Then we will apply the cuff of the blood pressure apparatus above the cubital fossa and inflate to the 60 to 70 mm of Hg. Then we will examine and palpate the selected vein. Then we will release the cuff and prepare the vein puncture site by scrubbing the area of 3 to 4 inches in the concentric spiral manner from center to the periphery. We will be using the spirit iodine or betadine spirit for the cleaning. Now the position of the bag should be below the level of the donor arm on the weighing scale balance. In automatic weighing machine, we have to adjust properly the amount of the blood to be drawn. Pass the donor tubing of bag through the automated clamp and the mixture. Now we will raise the cuff to the 70 mm of Hg just to make the vein prominent. Introduce the needle to the vein, remove the clamp and reduce the blood pressure to 40 to 50 mm of Hg so as to have the free flow of the blood in the bag. To keep the needle in the place, we are applying some bandage or tape on the hub of the needle. Ask the donor to squeeze the rubber ball and constantly observe the donor. Now, these are the following position, how the needle should be positioned in a safe manner to allow the free flow of the blood. Now we have to monitor the volume of the blood drawn. Mostly it's 1 ml of the blood is equal to 1.0 gram of the blood. So according to the below formula, we will calculate the bag weight and the volume we are calculating. After the required amount of blood is calculated in proportion with the amount of anticoagulant, we will clamp the tubing of the bag, deflate the cuff, place the sterile swab on the venipuncture site, apply the little pressure and remove the needle from the vein. Ask the donor to apply pressure on the vein puncture site, collect the sample in the vacutainer tubes, seal the tubing and separate the needle, dispose the needle in the puncture proof container. The blood bag kept in the fridge for approximately 4 to 6 degrees immediately after the collection. If the platelets are need to be separated, then the bag should be kept at room temperature for 6 to 8 hours and the donor sent to the post donation room for the refreshment and rest for 15-20 minutes so that the body can adjust the loss of blood. Collection should be complete should less than 15 minutes and the ratio of anticoagulant should be appropriate. That for if we are collecting 350 ml, then 350 plus minus 10% of the blood, and 450, the blood volume should be 450 plus minus 10% of the blood. Now, what is the post donation advice we will be giving? So, we will be telling the donors to drink plenty of fluids, avoid exercising for 24 hours, and remove the bandage after 10 to 12 hours. If bleeding occur from the venipuncture site, raise the arm and apply pressure. Avoid smoking alcohol before the next meal. Then benefits of the blood donation: it will lower the cancer risk, burns calories, prevent liver damage, reduces cardiovascular risk, balances iron level in the blood, produces new blood cells. That's all for us. Thank you.